Hi everyone, this is Paul from Ortho Eval Pal. Today I want to talk to you about hip dysfunction. We're going to do a little evaluation on George here. George is 48 years old. And how long has this hip been bothering you?
Started within a year.
Okay, and you're getting it a little bit on both sides now?
Yes.
Okay, so more on the left and then the right starting to kick in a little bit.
Yes.
Okay, where does it bother you the most?
Right in the crease where the groin area is.
Okay, great. Are you having any tingling going down your legs?
No.
And your legs don't ever give out from under you or anything like
No.
that? Any bowel or bladder problems?
No.
Okay. And do you have any pain when you cough, laugh, or sneeze?
No.
Okay. And so you drive a truck and you're doing a lot of delivery, you're sitting a lot, lifting, carrying, pushing, pulling. And one of the complaints that George has is anytime his leg goes into abduction, or he catches a toe maybe and externally rotates him, it bothers him. He's having a little bit of stiffness getting up out of a chair and taking off with his walk. And he's also noticed that he's limping a lot more. And how long has this been going on?
Yeah, it's been six or 8 months.
6 or 8 months, okay. And not getting any better?
No.
Okay, so one of the things that I've done is I've gone through a neurologic evaluation with him. Reflexes are fine, sensation's fine, distal muscle strength is fine. But I want to show you what we're going to evaluate next. So I'm going to have you lie right down on your back, George. When he walks, his leg does not extend past his body very well, so his pelvis anteriorly rotates a little bit more when he's in terminal stance phase. So first thing I did with him was I did a straight leg raise test, and his complaint was tightness in the hamstring. Okay, and then we hit a little bit of restriction there. I bent his knee, and this is very important if you're suspecting some sort of intra-articular problem. Don't let the leg fall out. Okay, keep him in neutral, okay, right straight on, and then try to flex some more. And I'm starting to hit some joint restriction here a little bit, getting a little uncomfortable.
Yeah.
Okay, and now I'm going to keep him at 90 degrees at the hip, and I'm going to internally rotate the leg. All right, so Alex, I'm going to have you kind of right down, straight on with the boot, okay, right there, great. And watch his internal rotation. Right there, we start, he's going, so he's having pain already. While we're at neutral, he's at 0 degrees. I take him out to about 5 degrees and that starts to hurt. So what I do is I then bring him in and I kind of go like diagonally a little more. And notice now we're at -5 to 10 degrees. I try to bring him to neutral, hurts again.
Yep.
Okay, and that's all kind of in the groin, isn't it?
Yes.
Okay. The other thing that he does is when he tries to reach for his foot, and I had him take his sock and boot off a while ago, when he reaches for his foot, he doesn't reach on each side with his hands. He takes his leg out like this and reaches on the inside. The other problem is that, look, he doesn't externally rotate very well either. And abduction is a little bit restricted. But very classic for intra-articular hip dysfunction is that he has this positive sign of the buttock where his pelvis starts to roll back quickly. He has loss of internal rotation, pain with flexion up there, and also some discomfort with hip adduction. Notice his pelvis comes along with him really quickly, and that's uncomfortable. Okay, so we're suspecting an intra-articular hip issue here. He's only 48 years old, but I'm very suspicious that he has some arthritis going on. I don't think this is a labral problem because he's having it on both sides. Okay, this one is less restricted, but still same presentation, just a little less restricted. So I don't think it's a labral issue because you never see that on both sides. Usually it's unilateral. He could have a pincer lesion, but you know, this is progressively getting worse. I think you would have had this by now. If he had a cam lesion, I think this would have presented itself by now also. So the way we're going to manage this is we're going to get an x-ray of this hip, or actually x-ray of both hips, and see if there's any degenerative changes starting. If there is, you know, he's kind of young, we're probably going to put him into a little exercise program to try to optimize the soft tissue mobility around his leg. And then we might also consider an intra-articular hip injection, and we have really good success with younger people who have early arthritis with the injection. Now, not only is that helpful for his pain, but can also help decrease his inflammation, and it can be very diagnostic, okay? Last thing I want to show you is a straight leg raise test, and this is quite common with people with hip arthritis. Go ahead and hold the leg up, okay? And I'm going to give his resistance down here, so hold it. And that's uncomfortable in the groin, isn't it?
Yes.
Now, if I do it on this side, hold it, hold tight. Where are you uncomfortable?
It's burning here.
More in the quad, okay? So what happens is he ends up with this kind of a prying effect in the joint, and that can give some irritation. So that's quite common with people with hip arthritis and intra-articular hip dysfunction. Now, he did have a hernia repair not too long ago, but that's not the pain that he's getting. When I do this and I move him passively, this is a joint restriction. I mean, it's hard as a rock when I do that. He really should have about 35 degrees of internal rotation, and if I put him in neutral, he has 0.